Okay, your cardiac S1 and S2. Okay, I don't hear any abnormal sounds. I'm not hearing an S3 or an S4. I'm going to listen with the bell now for any higher pitch sounds. I'm going to turn it back to the diaphragm. If you'll roll over just a little bit on your left side, I'm checking for any mitral stenosis, any extra murmur, any abnormal I might hear from your mitral valve. I can hear better with you laying on this side. Okay, you can turn back over. I need to find your PMI, so I'm going to go down to 5th. Intercostal space, about 7-8 centimeters, and see if I can feel it. It's tapping and it's just barely able to feel it. I'm going to listen to it now. If I can get you to sit up for me now. There's one area I need to listen to in the cardiac exam that will help me listen to your aortic area better. If you'll lean forward for me. Good. That's normal. All right, now we'll lay back down. And we're going to go to your abdominal exam. And I've already inspected it. I did that when I was inspecting your chest. So now we're going to listen for your bowel sounds. We'll listen in all 4 quadrants. And bowel sounds are active. Your tummy's growling. I'm going to listen here for your and then also your iliac artery for any kind of bruise. I'm going to check your femoral artery. Good. Good. I need to listen over that too. I'm listening for any bruise. Okay. Now I'm going to do some light palpation. Tell me if you feel any tenderness, if anything hurts.
Okay.
I'm feeling for any lumps, any masses. You all right?
Yeah.
Okay. Can I get you to bend your knees for me? That kind of makes these muscles a little bit not as tight, a little bit more relaxed. Okay. I'm going to do some deep palpation. Again, tell me if anything here hurts you.
Okay.
Any pain? Okay. I'm going to do some percussion. I need to percuss for your liver borders, so we're going to start up here. Midclavicular line. And I need to feel for that edge of your liver. So if you'll take a deep breath and hold it. Good. It's just barely palpable, about 1 centimeter here below this costal edge. Okay, you can go ahead and relax. Now I'm going to palpate for your spleen. This may be a little more uncomfortable. If you're turned towards me, just a little bit, roll over. Good. Anything here hurt?
No.
I don't feel anything, so I don't think you're able to palpate your spleen. Okay. Now I need to check on your kidneys, and I'm going to do the duckbill palpation. Any tenderness?
No.
Okay, I don't feel anything either. Let me go to the other side and we'll check the other side. No tenderness?
No.
Okay, good. Alright, now I'm going to move down to the lower extremities. Your calves are supple. I don't feel any varicosities, no lumps. Your skin is a little dry. Any tenderness when I do this?
No.
Okay. Okay, we're going to do some more of the musculoskeletal exam. I can get you to raise this leg up. Okay, can you pull your knee into your chest? Good. Stretch your leg out and down. Okay, now raise it up against resistance. Good. Okay, do the same with that one. And straight up. And then back down. Good. And then raise it up against resistance. Good. Now with your feet, if you'll up and down. And up and down. And no problems with that.
No.
You don't have any tenderness, don't feel like you're having trouble moving your feet.
No.
Your feet are a little bit cold, but it is kind of cold in this room. Because Jimmy has a history of smoking, then we worry about peripheral vascular disease. But his pulses are good, but he is a little bit colder, but like I said, it is cold in this room. Okay, let's do your hip. I want to check your hip range of motion. We're going to raise it up. I'm going to rotate it out and rotate it in. Any pain here in your hip when we do that?
No.
Okay, let's do the other side. Now let me come move it for you. Okay, out, out, good, and in, good. And no pain there.
No.
And no pain in your knees. I don't feel any swelling. Not having any trouble with your knees, right?
No.
Okay, I'm going to push this in and you can stand up for me. I need to have you walk. So if you walk towards the door and walk back on your heels. Good. And walk back the other way on your toes. And now if you can walk back towards me, and can you do heel to toe? Good. Good. Okay, now I need to get you to turn around. I'm going to check your back. I'm checking the vertebrae in your back. Good. And if you'll bend over, I'm checking the symmetry of your hips. Good. Okay, you can stand up. And I think that's all, Jimmy. Thanks for helping me do this today. I sure appreciate it, and I think that your exam was good.
You're welcome.